Good afternoon. My name is Lucy Aquino. I'm the Chief Executive Officer of HispanoCare Inc. And today you'll be watching an interactive show. With me today, you are
Patti
Correa from Passages Hospice here in Chicago. And we invite you to call in with any questions that you may have. And today we're going to be discussing hospice care. Patricia, hospice care and palliative care. Those are two terms that recently are used more and more. Can you give us an understanding or a definition of what palliative care is and hospice care? Because there is a misunderstanding on those two.
Yes.
Can you tell us a little bit more about that?
Well, hospice care and palliative care are very similar. I think our goal is to care for someone who has a serious illness.
Mm-hmm.
And palliative care is actually at the beginning of the disease. Okay, when they're first diagnosed, a person can seek palliative care.
Mm-hmm.
Okay, and they will help them through that process, and they can still seek a curative treatment while they're on palliative care.
Okay.
Okay,
Mm-hmm.
and palliative care, they want to make the person comfortable,
Mm-hmm.
that there's no pain, and that they are educated through the process,
Mm-hmm.
okay, of what the disease entails.
Mm-hmm.
Then when it progresses and it becomes a terminal illness, then hospice care takes place. When they've seeked all the options
Mm-hmm.
and there's not a curative treatment, then hospice care comes into place.
That's really towards end of life care.
And of life.
End of life care.
And of life treatment, yes.
Now, and usually end of life, when we're talking, it could be hospice patients that are expected to live 6 months or maybe longer.
Well, you know, the criteria say 6 months.
Mm-hmm.
Okay, so 6 months, we always say that the doctor needs to certify, you know, that the patient might have 6 months or less to live.
Mm-hmm.
But really, you know, it's not set in stone.
Right.
Right?
Absolutely. Absolutely.
It has happened that our patients sometimes stay longer on hospice or even improve
Mm-hmm.
during hospice care. They get so much care.
Good care.
that they
That's right.
that they improve,
That's right.
and we need to discharge them. And maybe at a later time, if they become ill again and there's a deterioration,
Right.
we can look them up again
Mhm.
and help them. They can
Right.
come
Right.
back and be on the program again.
Okay. Well, I know that, we're talking about hospice and palliative care today, but there are a lot of organizations out there that provide this type of care. And I want to thank Passages for being Passages Hospice for being here today and agreeing to come on the show to talk about these types of services. And Passages is one of many organizations that are out there providing this type of care. So Patty, so the difference between hospice and palliative care, we talked about that, and the program generally addresses the physical and the social, the psychosocial and spiritual needs of that as well. Correct?
Correct.
So it's not just the medical care.
It's not just the medical care. We have an interdisciplinary team of professionals that are there to help the family and the patient. We have from our medical director, our social services, our nursing department. We have a nurse and the CNA. We have a chaplain. There's several resources that the patient and the family has to reach out to, and just to know that we are there to answer any of their questions, to as it comes to whatever the patient is going through, to provide education, to provide support, to guidance. It's a group of professionals that are there to help them.
So it's
through
a big
this
team.
hard
It's a big team.
pro-
It includes a little bit of everyone involved. Now, I know that with hospice care too, some folks think, well, it's the end of life. I need hospice care. I'm at home. But that's not always true. You can also receive hospice care in a hospital setting, in a skilled nursing setting, correct?
Yes. A lot of times when I meet with a family actually the family or the patient thinks, okay, where do we go? You know, and okay, it's hospice. Where is your hospice?
Right.
And I say, well, we're not going anywhere. Or it depends on what your needs are.
Right.
Okay, where you want to be. Where do you want to be at the end of life?
Right.
Okay, it might be that the patient and the family have decided that they're going home from a hospital.
Right.
And so we can meet them at home. Or maybe they are in a long-term care facility.
Mm-hmm.
And we can meet their needs there as well.
So for the sake of those individuals who don't know, I mean, just because you're in a long-term care facility, and to think about it, I mean, you really don't think about, gee, I can actually bring in a different team other than the people that are here.
We work together. We work together with that facility, with those caregivers. So it's extra attention that they're getting from two different groups that are working together. We meet regularly. We talk to each other and centered on that patient, as this individual, to meet their cultural needs, their religious needs, because at the end of life, spirituality is very important.
Absolutely.
And their culture about what they want and what their needs are. And so we, as a team, talk about it with the family, with the patient, and to make sure that those last wishes are granted.
Right. I do want to remind our viewers that joining me today is Patricia Correa from Passages Hospice, and I'm Lucy Aquino, Chief Executive Officer of HispanoCare Inc., a program of Advocate Illinois Masonic Hospital and affiliated with Gottlieb Memorial Hospital and Melrose Park. And again, Patricia, I thank you again for being here today, because this information is so important. I mean, you hear bits and pieces about it. You hear about these services being available. But then you also hear about the cost that's involved in hospice and palliative care. Do insurances cover this? Is there help for the person who does not have the means yet requires and or needs this information and needs this help? Does Medicare cover it? Can we talk a little bit about that?
Yeah, it's surprising to me. A lot of people just don't know that they have those benefits, so that they're available, or even, that this is why do we, seek that as the end of life? Why, why are they paying for something like that? It's, and yes, Medicare does cover hospice care, and Medicaid or public aid here, state of Illinois, that is a service that they also cover. There's also some private insurances that have that benefit. And, in your private insurance, we would have to look at what services they do cover. But, most insurances do have something for palliative care or hospice services.
Now, well, just to go back though, Medicare covers hospice care, but Medicare, Medicaid does not cover palliative care here in Illinois, or do they?
Yes, they do.
So they do cover both. Because in some states they don't.
Uh-huh.
In some states they don't cover palliative care. They cover hospice care. But the state doesn't cover palliative care. But in Illinois, we cover both.
Medicare and public aid.
Yes. Well, that's good to know, especially for those individuals who've relocated from other states and now live in Illinois. They do cover that.
Yes.
That's good to know.
Yes.
Because even in doing some of the research and background, it still shows up that hospice is covered, but palliative is not. But in the state of Illinois, both services are covered.
Yes. And also, if you don't have any insurance, most hospices do have policies in place where they will still help you, and you can pay what you can afford, or they will help you. They will find a way for your loved one to get the services at the end of life.
So for those individuals who have a fear of, what am I going to do? Where am I going to go? How can I receive help? I mean, there are organizations such as Passages Hospice and many, many more here in the city of Chicago and the state of Illinois that just by reaching out to them, speaking to a social worker, speaking to an admissions coordinator such as yourself, can provide you and answer all those questions and give you all that information that you need. in such a horrible time in life. It's one of those difficult things that no one likes to talk about. It's very hard to talk about, and yet we have to talk about it. So if you have any questions, our lines are open. Telephone numbers at the bottom of your screen, area code 312-738-1060. Services that hospice provides to patients and families, Patti, there are so much of it. So what are some of the general services that for example, Passages provides?
Passages will have a nurse that's going to visit your family member or yourself at your home or the nursing home or wherever the place is. Okay, so we have a CNA that's going to go also and visit and provide personal care if needed. We have the chaplain that will provide spiritual, someone to pray with, someone, or if it's depending on your religion, they have resources to the community and to get depending again on the religion.
Right.
We have the social worker that can help you understand your diagnosis and the process. Reach out to other resources again of benefits that you can get. The admissions coordinators as well, they're always in contact with the family of what else we can do. How can we make this person's end of life be more comfortable?
Right. So, and then the daily task, of course, assistance with the daily task, as you were saying, with the patients, and acting as liaisons between patients and their primary care physicians and caregivers and all of that. So you're really the core of all that organizing, and helping to organize and make sure that things go smoothly and to provide the much needed care that's required.
Yes.
So there's a lot involved now, and that's in a setting of a hospital setting and or whatever. How about the in-home care?
In the in-home care, we will provide whatever equipment the patient may need at home, whether it's maybe an oxygen tank, an electric bed, wheelchair, whatever equipment that the patient needs to make them comfortable at home, we will provide it there. The nurse will come and visit the patient at home. Our doctor will come and visit the patient at home, or our CNA as well, to provide that daily care at home.
So, and of course, if they're required 24-hour care?
If they require 24-hour care and maybe they're having a symptomatic or an acute episode that cannot be, just managed by family, then we will send someone there, and what we call is a continuous care. Okay. And then once that's controlled, we go to what it's called routine care. Okay, so then we would only go a couple of hours to visit. Yeah, it is. We will not be there 24 hours a day on a daily basis.
But in-home care is available, but even if it's on if it's on and off here and there, it's available, and
we're available by phone 24 hours. If the family has any questions at any time, we can again help them through the process, or if we need to step in and make a home visit again, it's that's what we'll do.
Right. So Patti, can we talk a little bit about the diseases, because there are diseases that qualify for hospice care. So can we talk a little bit about what some of those are? Although some individuals might think, well, gee, I can never get coverage for this. But you'd be surprised how long this list is. It's really surprised me with the number of actually that I found that is covered under Medicaid, Medicare, and some insurance that picks them up as well.
Yes.
So can we talk about some of those? AIDS is one of those for AIDS patients.
AIDS is one of those. Right. It's at their terminal stage.
Right.
Renal failure. And that you can see a lot in the Hispanic community,
especially with diabetes,
especially because of the diabetes and going to dialysis, and then maybe they get a wound and it's infected.
Right?
Yeah. So all
such a disease that can be prevented.
But it progresses and it becomes it becomes terminal. And what I've seen is like a person with dialysis that maybe has had some amputations as well. And when that comes into place, sometimes, the person says, you know what, it's enough.
Right.
I'm not
Right.
going to be, amputated and again and again.
Sure.
And I just want to move on with dignity and comfort and at home.
Right.
And so we help, like I said, through
With
that
individuals,
process.
right.
Yes.
Now we talked about we also have Alzheimer's. We have ALS, Lou Gehrig's disease patients,
Yes.
cancer patients.
Heart
We have heart
disease.
disease. Obviously, we have pulmonary disease.
Yes.
Patients in coma.
Yes.
Dementia. Liver
Dementia
disease,
and
multiple
Alzheimer's,
sclerosis.
we see that a lot.
There's a huge stroke. Our stroke patients. There's just so much that's out there. That list is much, much larger than I thought. So, and I was very surprised to see many of these that would be approved for hospice care. So it's very important for you, our viewers, to know this important information for a loved one who may need and or require this type of service. Another common hospice diagnosis, adult failure to thrive.
Yes.
When you say
yeah.
that, what do they mean by that?
Well, when your loved one is losing a lot of weight, and they've tried, different approaches, and maybe, mom or dad is 85 and also maybe had a stroke in the past, and now she's just, not able to swallow and, not retaining the nutrients in her body, and they're, just not doing well.
Right.
And the options is probably to
So
get.
then now they're weak.
Yeah, they're very weak.
So sorry, they've lost the will to live.
Yeah.
You really look at it.
Well, the will to live, and also, the complications of the different diagnoses that a person has that contributes to that failure to thrive.
Right. So, let me ask you, Patti, in your opinion, what are some of the most important services that any hospice service can provide? What are some of the most important services you can provide?
Well,
either you, any hospice service.
The support, to be there for the patient, to be there for the family, and helping them put the plan together, because it's really, they're in control. They're in control of what's going to happen at the end of life. We are there to support their decisions, and there's no right or wrong answer.
Right.
It's whatever makes mom or dad comfortable. That's what we're going to do.
Right.
And so the most important thing is, that you have someone to reach out to, that, you're doing the right thing, and that you feel comfortable making those decisions.
Absolutely.
And that, you're granting mom and dad's wishes. So hospice is, it's the whole group and the family included.
Excuse me.
In making all those decisions. Right. We're not there to take over by any means. The family knows the patient better than any of us. We're just there to guide them through the process.
And Patti, I know that, we only have 25 minutes to talk about all these things, and it's just so much, but I know that you are this giving individual who is always willing to help out and to answer questions for individuals who might have questions. Is it okay to give your name? I really want your name to, and I wonder what I did. Here we go. I'm sorry about that. For Passages Hospice, Patricia Correa, Admissions Coordinator. Can you give out your number again, Patricia?
My number is 630-945-2725.
Can you do that again, please?
630-945-2725.
Thank you, Patricia. And I know for our viewers, if you have questions, please give Patricia a call. She'll be happy to help you, guide you if need be, suggestions, anything. Thank you for that. It's just so wonderful to see individuals like yourself and others who care enough to do those things.
Thank you for having me, and I
Well,
want to be able to help and provide.
Well, and
Some
I'm glad you're here,
services.
but we still have time for a few more questions, so I'm not going
Okay.
to let you go, but I wanted to make sure that our viewers knew that they have someone they can call on.
Yes.
And if not Patricia, anybody else, but or call HispanoCare, we can then guide you to some resources as well. Illinois Masonic Hospital, Gottlieb Memorial, our organizations such as Passages, again, they're there to assist and help, and we can provide you with referrals and or information depending on what you're looking for. So Patricia, I know that we talked a little bit about the patients, the team that takes place with this whole ordeal and organizing all of this. But the family fits into this team, like you said earlier. You're not taking over the care. The family has to be involved.
Definitely.
Because without them, you really can't get much done.
Right. Yeah. They know their loved one best. And, we have our interdisciplinary team.
Right.
And, again, we have, the nurse, the CNA that sees the patient and provides, daily care. And they see how their mood is in the morning, or if
Right.
they are in pain,
Sure.
when they're moving to the right,
Sure.
to the left, whatever, to know what's going to be more comfortable for the patient. The chaplain providing the spiritual care. And then we have, other extra services that can be provided as long as they're within the care plan for this patient. And our group, they meet regularly, and they discuss all of our patients that we're servicing to make sure that that plan of care is working for the patient.
Right.
Again, it's, day by day, it may change, what it's better for this patient. And so we just want to keep the family updated about what's going on regularly, and also just the communication, to be open communication at any time, for the family, for the patient, and the rest of the staff to work together to meet those goals.
I have time for one more question, but we got to answer it quickly because our time goes here by so fast. So that means I got to have you back because I didn't ask everything I wanted to ask, and I want you to come back. I hope you'll join us again soon.
No problem.
But there is a misunderstanding that people have about hospice. People have different opinions when it comes to hospice care. People think it's a place for dying.
Yes. Yeah.
Is that rumor or is that true?
I think it's a rumor.
It's a rumor. It's a rumor. That's not what it is. All right, and it's not actually a place that's just for that. It's a place where you're taken care of. It's a place about people who care about your loved ones to make sure they get the care that they need, the attention that they need. So Patty, I know that with everything going on and all the changes that are happening, and hospice care, palliative care, changes in Medicaid, Medicare, healthcare reform, and all those things that are happening, there's just a lot of information that's out there that individuals don't know about. Too many changes happening all the time. So the best person to speak to is someone like you or someone like your organization to get the best questions answered. And this year, because you're up to date on everything that's going on.
We try to keep ourselves up to date.
So
we have to. Yeah.
What's the best gift that you can give a family of a hospice patient?
What's the best gift?
The best gift.
Your time.
And
I think,
yeah, right. And I think too the honesty that comes out of it. There's an honesty that has to come out because we know eventually what's going to happen. And I know that within the Latino community and other cultures as well, is that the last thing we want to do is lead someone on. I think being honest with someone by making sure a conversation is started in the most honest possible way with family and the individual you're caring for.
yes.
And in different cultures there are different beliefs.
Yes.
And I really wanted to get into a little bit more about that, and we couldn't get into that. But next time you come back, that's what we're going to pick up on the cultural differences that are happening. So I want to thank you so much for being with us here today, and I'm hoping that we see you real soon to make sure that we pick up where we left off. We still had so much more to cover. But on behalf of Advocate Illinois Masonic Hospital, Gottlieb Memorial Hospital, HispanoCare, and Passages Hospice, thank you, Patricia Correa, for being with us today. We look forward to seeing you again soon. So until next time, we'll see you in April with a lot more information coming up your way. Stay tuned for the next show. Good information coming. See you soon. Bye-bye.